Lung cancer is by far the leading cause of cancer death among men and women. It claims more lives than breast, colon, and prostate cancers combined. One of the biggest misconceptions about lung cancer is there's not much hope once you're diagnosed. Here to share some promising breakthroughs with us, Johns Hopkins oncologist and Nebraska native, Dr. Julia Bramer. Barbara Martyr is a lung cancer patient. Good morning. It's nice to see you both.
Good morning.
Dr. Bramer, there's new hope for people who are diagnosed. What is it?
So there's a lot of new hope for our lung cancer patients. Certainly one is being able to test a cancer patient's tumor genes and looking for an abnormality. These type of genes can be targeted with drugs that we can use to personalize treatment. For those patients who don't have these particular genes, we also have immune therapy. This is a new type of therapy that we're using to be able to unleash your own immune system to actually attack the cancer.
It sounds pretty high science. So Barbara, I'm wondering if you could share your story, because you're an example of how these new treatments can have amazing results. What have you seen?
Yes. About 4 years ago, I was diagnosed with lung cancer, and at that time I had a rather standard treatment of surgical removal of my tumor and the surrounding lymph nodes. All looked good. I had a few rounds of preventative chemotherapy just in case there were some mutations that were out floating around, and all seemed still good. About 18 months later, the cancer had metastasized to the other lung, and I knew I was in trouble again. At that point, I really wasn't a good candidate for some of the other chemotherapy treatments because I'd been a kidney donor and the drugs are a little hard on the kidney. I talked with Dr. Bramer at that time and was able to enter a clinical trial using immunotherapy. For me, this has been wildly successful. Within weeks of starting the treatments, my tumor started to shrink. Within 6 months, it no longer appeared on any of the scans. That was over 2 years ago. I continue with the treatments, and I continue to have absolutely clean CAT scans.
Wow.
I could not be happier. I just hope that others can benefit in the same way.
It sounds miraculous. Doctor, what type of testing is needed for patients to qualify for these new treatments?
So first, a cancer patient's tumor is actually being tested to look for genes where we can develop a targeted treatment, but also we're looking at research to be able to figure out who best to give immune therapy for. Through research, we can equate this to giving our patients hope and actually able to change treatment. And certainly through research, we need more funding to support that. In order to support that, which unfortunately lung cancer gets one of the least amount of funding from the federal government, groups like Lung Cancer Foundation of America help fund research through giving campaigns. One particular campaign this coming month in July is 30 Days, 30 Ways, where people can actually take a particular day, such as for me, my mom's birthday on July 2nd. I will be posting on Facebook and hoping that my friends and family will help contribute to this campaign by going to the website lcfa.org, lcfamerica.org, and again, taking a survey, giving a chance to win a Fitbit, and then contributing to this campaign to raise awareness as well as funding for our lung cancer research.
It's very clearly we're making progress here, and to even have this word hope part of the conversation, it's so important for patients. Barbara, thank you. Dr. Bramer, thank you. And a shout out to Wisner. You got a lot of proud people watching there today. Thank you both.
Thank you.
All right, Mike, we'll send it over to you.